Hi, my name is Aurora Lucas, and I was diagnosed with lung cancer at just age 28. And when I look back about the 3 months of medical gaslighting that I had experienced, I've been looking more deeply into the structural reasons of why this may have happened. That's my other camera. And yeah, so did you know that gender bias in medical healthcare significantly impacts women, especially in lung cancer treatment and diagnosis? This bias often manifests in the assumption that lung cancer primarily affects men, particularly those with a history of smoking, while ignoring or downplaying the fact that smokers, especially women, are increasingly diagnosed with lung cancer. Here's how gender bias affects women in lung cancer care. So, first pointer is delayed diagnosis, which I had experienced. Women, particularly young women, often experience delays in diagnosis because lung cancer is still seen as predominantly as a man's disease. Many women with no smoking history are not immediately considered for lung cancer screenings, leading to advanced stage diagnosis as healthcare providers may attribute symptoms like coughing or shortness of breath to less severe conditions such as asthma or allergies. Number two, underrepresentation in research. Historically, women have been underrepresented in clinical trials for lung cancer, leading to a lack of gender specific data on how treatments affect women. This creates gaps in understanding how lung cancer manifests and progresses differently in women, limiting personalized treatment options. The EGFR mutation. Okay. Many women, this is number three, many women, especially Asian women, are diagnosed with lung cancer due to EGFR mutations, which are not related to smoking. Despite this, there's often a lack of awareness in the healthcare community about this genetic predisposition, contributing to delayed treatment for these women. Number four, disparities in treatment. Studies show that women with lung cancer might receive less aggressive treatment than men, especially older women. There's also evidence that women may not be offered the same access to clinical trials or the latest therapies, which can negatively affect outcomes. And number five, stigma and misconceptions. Women with lung cancer, especially non smokers, may face stigma and assumptions that their condition is tied to smoking. The stigma can lead to feelings of shame and reluctance to seek timely care, exacerbating health outcomes. So, there's a lot of biases and baggages related to gender bias and lung cancer. And I really am curious. This is still like a topic that I'm reading into and learning more about as I do this advocacy work. But I'm saying this here on TikTok because if you are a woman and you are trying to get diagnosed with lung cancer and you're not able to access the testing or no one is believing you, please know that you are not the problem. Please know that there's structural issues here. That's why I'm very, very passionate about you raising your own voice and learning how to navigate the healthcare system because I don't know how to change these systems, right? I don't know if people ever change or their biases. That's a big task. But what I can do is for those people like you, if you are trying to get newly diagnosed or if you're trying to even reach that diagnosis in lung cancer or for lung cancer and no one is believing you, please hang on. Please, please, please still speak up for your voice. Find ways, find your community that could uplift you and ask questions. I know it's exhausting to even try to get this diagnosis, but there's a whole community of us. There's even Facebook pages for lung cancer patients. There's Facebook pages, well, there's a Facebook page for the Young Lung Cancer Group. And there's a lot of us here who have experienced late diagnosis, a bunch of misdiagnosis. I have a friend who it took over a year for her to advocate for herself. But please know that you are not alone. There's a few research, and it is known to researchers that women have a late diagnosis and it's not until stage 4. And that's something that needs to change. So please comment or send me a direct message if you have any questions. Thank you.